atherosclerosis, as a part of arteriosclerosis, is a chronic disease with impaired lipid protein metabolism, deposition of low-density lipoproteins or cholesterol in intima of the elastic or elastomuscular arteries, and subsequent overproduction of connective tissue with the formation of atherosclerotic plaque. And organ consequences are mostly connected to this narrowing process, narrowing of the lumen, and causing, which causes organ ischemia. You see, at the first stages, I hope you recognize the anatomy on this cartoon. So this is intimal layer, this is media, and this is adventitia. You see, under normal conditions, intima is much thinner as compared to the medium. At the first stages, fatty streak, some fat, additional fat in the intimal layer. Intimal layer becomes a bit thicker as compared to normal, but there is no any clinical manifestation. The lesion is quite silent, and just a slight thickening of the intimal layer. Then we don't recognize such stages, such terminology we do not teach you, but really these are all synonyms. Intermediate is before the atheroma, but you see here considerable thickening of the intimal layer, but please appreciate very minor narrowing of the lumen. This minor narrowing still has no clinical manifestations, because the blood flow is more than okay in the normal vessel, and the ability of the vessel to feed the tissues is not impaired, is not changed when the intimal layer becomes same thick as the medium layer. But now here it's about 50% stenosis. 50% is not necessarily clinically evident. For coronary arteries, we recognize the threshold of 70 to 75% even. It used to be 60, but 50, it is still okay for organ microcirculation. But we can notice here formation of the lipid core in the center of the plaque. Here, all the lipids were stored just in the cytoplasm of macrophages. And here, macrophages really fail to still keep all the lipid droplets in the center, in the cytoplasm, so that macrophages disintegrate and start to form this lipid core, which increases in size with thickening of the intimal layer.